Welcome. So the neck, releasing the neck. This is for self-therapy, something that you can offer yourself and also something that you can share with your clients. So often neck therapy is related to this tension that can relate to our posture throughout our day, a lot of the everyday activities with our arms out to the front. It can internally rotate the shoulders and put some tension through the back of the neck. The extension through the cervical can cause tension. So a few really simple activities that we'll look at today. It's to release the upper trapezius that relates to the shoulder and then attaches up into the back of the neck and into the occipital ridge. The lavator scap, which attaches onto the medial superior border, so the top inside corner of the scapula, the shoulder blade, and then attaches up onto the transverse processes, the side bony attachments through the cervical spine. And then the SCM. So the SCM travels down from just behind the mastoid process, and it's that big muscle that then comes onto the sternocleidomastoid joint. We'll also work with some tension release for the fascia around that area. So I hope you enjoy. Let's join me for this practice. So it's a self-guided practice that will be most supported in a seated position. I'll also show you a few techniques that you can do lying down. Standing really is not as optimal for these practices because standing doesn't allow for you to really work with focusing on that area, isolating that area. So let's begin. Begin just by stacking the crown of the head above the heart and then the heart above the pelvis. So finding a nice vertical alignment, a stacked position for the spine. So let's just close down the eyes here for a moment and just take a few deep breaths to settle into this moment, into your environment, and into yourself. Allow your breath to land naturally and deeply within the landscape of your own body. Just feeling the inhale and the exhale. Feel the inhale like an expanding nature. And the exhale draws you back inward towards yourself. Inhaling breath. Exhaling breath. Feel the inhale draw from the earth to the sky. And the exhale, sky to earth. Feel the breath encourage a gentle movement of the spine. Feel how the inhale has an uprising, slight extension of the spine. And the exhale, a descending, slight flexion of the spine. 2 more breaths in your own rhythm here to settle into quietness, allowing for a deeper sensitivity. Great, a gentle gazing open of the eyes. So first one, we're going to release the upper trapezius. So take your hand and place it palm up underneath your butt cheek. Let's go for the left hand side. So left hand underneath left butt cheek. Palm facing upwards. As the palm faces upwards, stack the crown over the heart. And then just gently feel the right ear draw down to the right shoulder. Inhale, breath, lift the top of the crown up to the sky. Exhale, breath, right ear to right shoulder. This right hand is just a guide, so we're not pulling down, reefing down on the head. We're just allowing for a little bit more gravity here. So over the top of the head. And then slightly sway your whole body over to the right hand side here. Feel this nice lengthening from the tip of the shoulder up towards the ear. Great. Take a few deep breaths there. Notice if the spine starts to lean and gaze forward. Just draw it back so the heart is still gazing in line with the pelvis. So that might be enough for you. You might feel this slight conversation happening with this increased sensations through the left side of the upper trap. For a little bit more here, you could start to press the head into the hand, really gentle. Too much force will start to switch on the muscle and could cause you some strain. So we're asking the muscle here to contract while it's in a stretched out position. Inhaling breath there. And on the next exhale, let the head relax and see if you can drift the right ear towards the right shoulder a little more. And maybe sway over to the right hand side. Let's go one more breath here. And exhaling breath. One more contraction here. So while the muscle's stretched out, start to switch it on. Really gentle contraction. Press the head into the hand. And as you exhale, let everything relax, tension releasing. You could continue that another 2 times or even just pause here in stillness. Let the breath guide the muscle to relax. So if you're continuing this practice outside of joining me today, you might hang out here a little longer. As you gently release, ensure that the head doesn't slingshot. So gently release the hand. Gently lift the crown up towards the sky. And gently release. Maybe close down the eyes and just notice the sensations from the left ear to the left shoulder. Maybe awakening up the sensitivity sensations through the tissue and the skin. Next one, we're going to now internally rotate the shoulder, which will start to access the lavator scap. So same kind of movement where the hand comes underneath the butt to stabilize and able to isolate the lavator scap, but this time a slight internal rotation. Place the palm now face down towards the earth. And now we're working on that same side, but lavator scap, so that muscle that travels from the shoulder blade, the scapula, up towards the transverse processes of the cervical spine. This time we're going to gaze down towards the right armpit, chin in towards the armpit, gazing down. Keep the spine stacked initially. And then this time the hand comes straight in front of the face and over the top of the head. So you're kind of facing towards that right knee. And then start to lean forward towards the right knee. That might be enough for you today. Take a few breaths there. Sometimes you can get like a shearing sensation, like a Chinese burn down through the arm. It's working on the fascia and the nerves of that left arm as well. For a gentle contract, relax. Gentle is the ideal option here. I'm going to press my head into my hand. Inhaling. Exhaling, keep the contraction on. Inhaling one more time. And as you relax, let the head relax, shoulders relax. Maybe draw the head in towards the armpit a little more. No force here. Inhaling breath, press the shoulder, press the head in towards the hand. Pause here as you breathe naturally. And on your next exhale, let the head relax. Perhaps drawing chin in towards armpit, perhaps leaning a little more over towards that right knee. And release gently. Release the left hand. Just place both palms on the knees for a moment. Close down the eyes. Bring the crown and the head over the heart. Heart over the pelvis. Stacked spine. Let's now continue to the next movement. It's working on the fascia on the front of the neck. Often we focus so much on where the discomfort is. Sometimes the pain is in the back, and sometimes that's because of compression through the front area. So this works on the SCM, that big muscle through the front of the neck that sometimes can get tight but can often get weak as well when the chin comes forward or when the thoracic spine flexes, the cervical needs to go into extension. So sometimes when you've got tension headaches through the back of the occiput, it can be because this muscle has got somewhat weak from our posture. So we're going to place the left hand just underneath the clavicle here, collarbone, and just rest it there, wide palm underneath the clavicle onto the tissue here, around subclavius for those who know it. Feel the heart gently gaze upward on a diagonal here, so the spine is nice and stacked. Resting left hand, right hand comes on top of left, and there's just a gentle gravity pull downwards towards the earth. That might be enough for you. I'm going to take you through a few motions, and as I said, in your practice you might want to hang out here and explore this a little more. So first we're going to just bring the chin forward, and then gaze up to the sky. You'll find a nice stretch through the front of the neck. And there's a few options here you can play with in your own practice. It might be really allowing for that extension to come through the front of the neck. And then still focus on the jaw drawing forward. Even like a jutting of the chin forward. You can start to rotate the head. Go slow. You'll find when you go slow, you notice different fibers of the tissue that are having a bit of more of a louder conversation. So if the conversation becomes a little bit louder, you could create some micro movements there. So the micro movements, say it's in this position, it might be just a slight rocking in the rotation in that small plane of movement. So rotation is an option. You might drop the right ear towards the right shoulder and then create a little rotation there. It will get more into the SCM muscle here. And then you could gaze up to the sky and jut the chin a little bit more further up to the sky. Breathe naturally here. So start to create and just explore some rotational movements of the head using a jutting forward of the chin. And gently release. Relax there and notice the sensations. Notice the calming of the mind. When we relax the tension between the head and the heart, there's a calming of the nervous system. So I'm going to fast forward the other side so you can watch this again and go in slow motion. So let's just recap now. Upper trap, palm faces up underneath the butt. This is like a quick little tack, yeah? Let's revisit together. Keep the spine nice and stacked, left ear to left shoulder. Perhaps that's enough for you. Perhaps you take the left hand over the top of the head towards the right ear. Once again, that might be enough. If you choose to go a little bit further, gaze the whole body, just shift it over to the left-hand side. Option to contract, relax here, gentle contraction, head in towards hand on the inhale. Pause for a few breaths, exhale the contraction on an exhale. Go slow. Gentle contraction is the key. If you contract too much, you could cause that strain. And it's counterintuitive because these techniques when you do the contract relax, we're contracting the muscle in a lengthened position, which means we're awakening the length and the strength of the muscle. We're also releasing the tension globally through the whole muscle, and also focusing on the little areas, the fibers that hold the tension along the whole fiber of the muscle. Lavator scap, palm faces down, internal rotation of the shoulder, back underneath the butt. This time, chin in towards the armpit, gaze down. Hand comes over the top of the head here, and then start to sway the whole body over towards the left shoulder. I can start to feel that through the nerves and the fascia, which is like a Chinese burn sensation. You can feel this possibly into the elbow or maybe all the way down to the wrist. Contract, relax here is an option. Head presses into hand gently, inhaling. Pausing for a few breaths. Exhaling as you relax, head draws in towards the armpit and maybe head gazes forward towards that left knee. Gently release slowly. SCM, fascia through the anterior cervical triangle, through the front of the neck. Right palm underneath clavicle, just resting there. Left hand on top. Left hand causes a little gravitational force downwards towards the earth. Let the shoulders and elbows here relax. Lift the crown to the sky, jut the head forward. The chin comes forward before the eyes gaze to the sky. Pausing here before you create some rotation. Explore the full range of motion here. Encouraging extension of the fascia, which means the chin is always actively involved in the movement. Rotating in that position, maybe dropping ear towards shoulder, rotating, eyes gaze to the earth, eyes gaze to the sky. And gently release. So keys here, spine is stacked, breath is guiding the movement, and any kind of contraction is a gentle contraction. The other thing when you're working with fascia especially is there's always this activation. So we're not like relaxing into deep stretch. We're really actively awakened within the movement, which means the posture is really supporting a full extension of the fascia. So you can do some of these through a lying down position, and you can also repeat these same movements if you're sitting on a chair at home. So if you're sitting on an office chair even, then really think that you're pressing the sit bones into the earth at the base of the pelvis, and press into the feet, pressing into the earth. When you press the feet into the earth, you feel the spine actually awaken and elongate. There's some other movements that we can work that work into the shoulder and work into the fascia of the shoulder. We'll go into that more in some other tutorials coming up. So there are many different ways that you can release the fascia and the nerves, the brachial plexus that comes off the base of the cervical spine, branches down and then underneath the acromioclavicular joint, and then radiates the nerves down from the brachial plexus and branches into the radial, ulnar and medial nerve. So if we were doing this lying, and I'll go into a little bit more detail in another video, but if we were lying down, for example, I could place my hands behind my head and interlace my fingers. When I interlace my fingers, I really don't want to cause strain through my neck. And remember about that lengthening of the tissue. So I really want to draw the crown away from me. And then as I lift up using my hands a little bit, if I'm going to press back towards the earth, see how my chin draws in towards my neck. So that's also working on the upper trapezius and also some other erector muscles through the back of the spine especially in the neck, like splenius capitis. You don't need to remember those names. It's more about the awareness of what's happening in your body, deepening your relationship with yourself. So chin comes in, presses in towards the neck to press the head towards the earth. What we don't want to do is really press down with force where my chin comes away from my neck and my eyes gaze towards the sky. So my eyes are wanting to gaze in a diagonal position here. And really, working with those principles of going slow, working with your breath, keeping the spine stacked and keeping some extension through the muscles and the fascia that you're working on are really going to support you to explore different sensations through the neck and through the upper shoulder region. So you can really deepen this relationship of what's happening with the tension through your neck. It's going to feel different left to right hand side. So really explore it in your own practice. Go slow, enjoy the practice, and be empowered by releasing tension through your own neck. Hope you enjoyed and are able to practice with yourself and share with your clients and friends, with those who experience tension through the neck. Enjoy.